It is good practice to make an appointment with a healthcare provider or cardiologist who specializes in the heart for regular screenings if you have heart disease symptoms or may be at risk for heart disease. A medical history, physical exam, and blood work can help detect heart problems. The testing measures a healthcare provider will use depend on the specific type of heart disease. Other types include congestive heart failure and arrhythmias, abnormal heart rhythm, among others. A routine physical exam will likely include checking your body for physical symptoms, example heart rate, blood pressure, and temperature. A physical exam can sometimes diagnose certain types of heart disease, such as heart failure. A healthcare provider will often order other diagnostic tests to further explain your condition, including the severity. A physical exam can help a healthcare provider learn about your symptoms and how to move forward with testing, if necessary. Additional testing measures for heart disease can be expensive. It's important to give a healthcare provider all the information you have about your symptoms so they can calculate the exact tests you may need for a diagnosis. Blood tests. A healthcare provider may consider several blood tests when evaluating heart health. Blood work can detect heart problems and evaluate your risk for heart disease. This non-invasive test checks the heart size, shape, and location and can show if you have any fluid buildup. A radiologist, who specializes in medical imaging, will perform the chest X-ray and work with a cardiologist to understand your test results. Non-invasive procedures. An invasive procedure is when a healthcare provider uses medical instruments to enter or cut into the body. A non-invasive procedure does not require a healthcare provider to break into the skin to perform a test. Electrocardiogram. An electrocardiogram, also known as an EKG or ECG, is a standard medical procedure for heart disease screenings. This non-invasive test can be done in a healthcare provider's office, ambulance, or hospital. The results can give a healthcare provider clues about structural damage to your heart or the possibility of a previous heart attack. An EKG can also give information about an active heart attack and abnormal heart rhythms. A healthcare provider may want to monitor your heart rhythm more closely to ensure your heart functions normally. This non-invasive test can check 12. How much blood is being pumped from the heart with each heartbeat, how well your heart valves and vessels are working, if you have a tumor or blood clot in your heart chambers, if your heart valves are too wide or narrow, the size, shape, and strength of your heart muscle. The structure and motion of your heart. An echo can take up to 1 hour to conduct. A healthcare provider may use an echo regularly for routine appointments and screenings if you are at risk for heart disease. Computed tomography, CT, scanned. A computed tomography, CT, scanned is a non-invasive test that uses multiple computerized X-rays to create a detailed image of the heart and blood vessels. A healthcare provider will look at cardiac chamber size, valvular size and calcification, calcium buildup, and vessel sizes. The test can show fluid buildup around the heart, injury to the pericardium, the tissue and membrane sac that surrounds the heart, plaque buildup in your arteries, vessels that carry blood from your